Good afternoon, everybody. Thank you all so much for joining us today for today's webinar. I'm Margot Price, the Director of Alumni Relations for the School of Public Health and Tropical Medicine here at Tulane. It is an honor to be able to present the first of a series of webinars that highlight the wonderful work and minds of my colleagues in the School of Public Health and Tropical Medicine and our partners across the university. Today's webinar, titled Water Health is Public Health, features Dr. Charles Miller and Tiong Au of the Environmental Health Sciences Department in the School of Public Health and Tropical Medicine as our panelists, and Mark Davis of the Environmental Law Department in the Tulane University Law School as our moderator. Dr. Miller completed his PhD in environmental oncology at New York University and his postdoctoral fellowship at the Roswell Park Cancer Institute in Buffalo, New York. He has taught in the Environmental Health Sciences Department at Tulane since 1994. A member of the American Association for Advancement of Science and the Society of Toxicology, Dr. Miller's primary areas of study include chemical carcinogenesis and molecular and mechanistic toxicology. He is also a proud member of the Delta Omega Public Health Honor Society, the ADA chapter. Dr. Au is an associate professor in the Department of Environmental Health Sciences, School of Public Health and Tropical Medicine here at Tulane. Dr. Au is a public health microbiologist with diverse training backgrounds, including environmental engineering, microbiology, virology, and bioinformatics. His research has been focused on environmental microbiology and water quality and its interface with both public and ecosystem health. He works closely with interdisciplinary teams of scientists and stakeholders to address important environmental health and water quality problems in the Gulf Coast region. Mark Davis is the Robert C. Cudd Professor of Environmental Law at Tulane University Law School, where he serves as director of both the Institute on Water Resources, Law and Policy and the Center for Environmental Law. Prior to coming to the law school, Mr. Davis served 14 years as executive director of the Coalition to Restore Coastal Louisiana, a broad-based organization committed to the stewardship of Louisiana's coast. Prior to that, he practiced law in Indiana, Illinois, and the District of Columbia for more than a decade. He's a member of the bar in Indiana, the District of Columbia, Illinois, and Louisiana. Mr. Davis has taught as an adjunct faculty member at the Indiana University School of Business in Indianapolis, the IIT Chicago-Kent School of Law, and Loyola Law School here in New Orleans. He is currently an adjunct instructor at the Tulane University Law School. Mr. Davis has a BS and JD from Indiana University and an MLT from Georgetown University. He currently lives in New Orleans. Before we begin, I invite you to utilize the chat box today for any or all questions you have for our panelists and moderator. Thank you again for joining us today, and now I'll turn it over to Mark.
Thank you, Margot, and hello, Drs. Miller and Au. What a way to spend a Wednesday. I have to say that, I suspect the three of us spend more time thinking about water and health than maybe most people do. But you don't have to look very far in the headlines to see that, our worlds and kind of the concerns of the general public are getting closer and closer. We were chatting a little earlier that we've had boil water advisories here in New Orleans in the last week, and just looking nationally, for those of you who follow things in Southern California, in Tulare County, they're running out of water, and of course, perhaps one of the most profound health risks for people is when they don't have something they absolutely need for their well-being, water. So clearly there's a lot going on. Some of it is just, if you will, the normal aging of infrastructure and the like, and some are the dynamics of climate change. But one thing is sure, and that is the way we deal with water and the way we deal with health are coming, more and more into the same sphere. And I want to just kind of, get your initial thoughts about, how you see that happening. And if there was one thing you might ask, our audience, to pay attention to, so they could be more aware of the things you're paying attention to, what might they be? And then we'll get into a more open discussion. Charles, why don't you lead off on that if you might?
Yeah, thanks for having us today. And I think the Western United States is in a lot of trouble. And it looks like there's not enough water to go around for everyone out there. We have agricultural needs, we have industrial needs, and we have the cities and the people who need water there. And so I'm wondering myself a lot, and I bring this up in some of my classes, if there's too much population and too much going on in the West to actually be sustainable and to support everybody having the water that they need to do whatever they need to do. So I think that's our biggest, at least short-term challenge right now.
Well, I can tell you that, they plan for water differently than we do around here. And some of their water planning calls for things like the Mississippi River to not necessarily just flow by New Orleans, but to find its way to New Mexico, Arizona, Utah, Colorado. So yes, water ties us together. Dr. Ah.
Yes, we always think, like, for example, me, I always think about this question, like water quality and health, and what is the connection? And as you mentioned, water is a basic human need, and we need water to survive, and we cannot live for a few days without water. And we often define a safe drinking water as clean. For example, what does this look like that is not dirty? And wholesome, which is good for you. And drinking water quality has a major influence on public health. Even in the United States, clean water is not always assured. Like, for example, about 15% of households in the US obtain drinking water from private wells. And later it's known about the quality of water from this unregulated source and the potential impact on human health. So, besides a clean supply of drinking water to sustain our health, and we also have to aware that most of the water we use is for agricultural, industrial, and recreation. And of course, water is also needed for ecological processes that's not directly related to human use.
That's a lot to keep in mind. I've got to say, I'm already tired. But some of the things you mentioned there, John, caught my attention because I know, I'm often asked, well, do you drink tap water here in New Orleans? Or do you drink bottled water? And I confess that, every time I'm asked, I have to revisit the decision that I make. And I generally drink tap water here in New Orleans. But it doesn't mean I don't think about it. What sorts of things, what sorts of contaminants, might be in our source water and might be in our tap water that we need to be thinking about and managing for?
Yeah, I mean, in New Orleans or even in other cities, I drink tap water because I believe that I'm sure that the tap water here is treated, and also in order to meet the regulation set by the U.S. Environmental Protection Agency, or EPA. So in terms of the contaminants, the Safe Drinking Water Act defines the term contaminants as meaning any physical, chemical, biological, or radiological substances or matter in water. So, the regulation defines contaminants very broadly as being anything other than water molecule. So, drinking water may reasonably be expected to contain at least small amount of some contaminants. Some drinking water contaminants may be harmful if consumed at certain levels in drinking water, while others may be harmless. So the presence of contaminants does not necessarily indicate that the water poses a significant human health risk. Like for example, there are biological contaminants, which are organisms in water, and they are also referred to as microbes or microbiological contaminants. Example of biological contaminants include bacteria, viruses, parasite, and these microbes can cause enteric diseases or intestinal illness. So, and other contaminants, for example, chemical contaminants, these are elements and compounds, and these contaminants may be naturally occurring or man-made. Examples include nitrogen, heavy metals, pesticides, or even toxins produced by bacteria or human or animal drugs or pharmaceutical compounds.
Well, it's good to know that the law has all that covered, and that the law makes sure that every drop is clean, and the law knows exactly which contaminants we should be worried about. And the law never changes except to improve. That's what we like to tell people, but it isn't quite true. Indeed, most of the things the law specifically protects us against were written into law, years ago. And it turns out that we keep inventing things, or we keep learning things. So I guess one of the questions I would ask is, well, if the law is kind of a baseline of what we should be managing for, if you guys could ask the law to do something different or better in order to really focus on public health, not just compliance with a law, what would you point us to? Charles, why don't you take the first whack at that?
Yeah, so there's a lot of examples of what you're asking, and I think with Flint, Michigan, and the lead story in the water is an interesting story. In general, we do a pretty good job of this in this country of keeping lead levels low, not zero, but low, and what we believe is safe. And then on the horizon are the perfluorinated compounds. These are the everywhere, forever chemicals. And so they're in the dust in your home, they're in the air that you're breathing, and they're in water supply. And New Orleans has a little bit of this contaminant in its water. It's a big family of chemicals that contaminate the water, the perfluorinated compounds. And I think there are around 40 parts per trillion right now as a total group in our water. The EPA and other agencies are trying to figure out how low should be for these chemicals. There's a new proposal that they're going down in the sub parts per trillion range as a safe level for these chemicals. And it's going to be a challenge for chemists to even measure chemicals at that concentration. It's like trying to see 100 miles away, that magnitude. So these are some of the challenges. And then one of the challenges is in the West, as we were talking about a minute ago, they're trying to reuse water. And you have to get these perfluorinated chemicals and a lot of other chemicals out of the water, out of wastewater, so you can reuse it safely. And I think that's going to be a big challenge.
Well, that's your comment about those forever chemicals, sometimes called PFASs and things like that, which kind of got off the leash actually before we started to understand what they did. But I saw in my news feeds today that the Attorney General of Wisconsin is filing a lawsuit against a number of industrial actors for essentially contaminating, water and air.
Mhm.
And again, money won't necessarily fix it, but at least it might make cleaning up or avoiding problems someone else's responsibility as well.
Right.
And I think it also raises a question that, so can I go go to Home Depot and buy myself a water filter for my tap and knock all these problems out? I don't worry about lead. I don't worry about forever chemicals. I don't worry about fecal coliform. Should I do that and not worry anymore, or should I go out and buy myself a bottle of water at like a Dasani bottle of water and never worry about tap water again? John, what do you think about that? I mean, you already told me you drink tap water, so.
Yeah, I think, in terms of the household water filtration, it is important to keep in mind that different water filters have different functions. Some can make your water taste better, while others can filter out harmful chemicals or microbes. And no single filters can keep every types of contaminants out of drinking water, and not everyone's need a water filter, right? So the water that comes to your tap actually contains a small quantities of many other substances, and some of these are beneficial, and such as the appropriate amount of disinfectants like chlorine, and that helps keep your water safe from harmful microorganisms, and fluoride, so which helps prevent tooth decay. So and some other substances that may be in water can be harmful, such as lead, for example. So filters can remove both good and bad substances from the water, and depending on your conditions, filtering your water might not be a good idea. So the filtration needs really depends on the quality of your water supply and your personal preferences when it comes to taste, and any specific or special health conditions in your household. So it is important to learn more about your water sources, right? If you get water from a private wells, so you should have the water tested by a state certified lab at least once a year, and you may need a water filtration system. But if you get a water from a public system, you will get a report on your water quality each year. So you can decide whether you need the water filtration based on the water quality report.
And by the way, here in New Orleans, we just got our water quality report from our water utility. And according to it, it was generally at least hitting all those required targets and reminding you about the testing. But we don't really have to worry, because you mentioned source water. I mean, you need to know where your water comes from, so you'll know what you're filtering and testing for. But we get our water here in New Orleans from the Mississippi River, which is crystal clear, never polluted. There's never been an accident, Is that right? Am I right about that? I mean, that's what I like to tell myself. Charles, how is our source water, and what should we care about?
Yeah, I'll add, I drink the tap water too, and I know that it comes from the Mississippi River. I think it's safe in general, at least for the things that EPA wants the Sewage and Water Board to monitor, as they've clean up and produce the water for drinking. One of the things that I see a lot is there's a little bit of alarmism in that they tell you in the news that something has been found in the water. They don't usually tell you how much it is and whether it's a significant amount and whether or not it's expected to produce a health effect.
Mhm.
So as a toxicologist, we have the mantra, the dose makes the poison. And a lot of times those are really minuscule doses and I don't worry too much about it.
Well, one question I know we're going to get is, so, should I hedge my bets though? I mean, is all tap water, I guess, more compromised than bottled water? Is bottled water your gold standard, or,
No,
no?
there's been bottled water contamination issues too. Whole Foods, for example, had some bottled water removed for arsenic contamination.
Well, that's bad news.
So you can't look at a bottle of water or what comes out of your tap and say, that it's good or bad.
Well, and am I correct in understanding that a lot of bottled water is just tap water? It's somebody's tap water, so it's not from some garden spring guarded by elves.
Right.
And
It's usually purified tap water or taken from groundwater.
Right. And so but when I buy my bottled water, and when a lot of people buy it, and quite frankly, in a city like New Orleans, we're quite, sadly, we have a lot of people who, I think, live with less means and fewer opportunities, but they often still buy bottled water. I mean, are they really getting a health benefit, or are they actually essentially, have they been convinced to tax themselves, to pay more for water that they may not actually be getting an additional benefit for?
Yeah, I think that's true, that bottled water is extremely expensive per gallon relative to tap water. And it's not good for the environment either. There's a lot of environmental issues. There's a lot of equity and cost issues that are associated with using bottled water as your drinking source.
I would point out, just having, occasionally bought a bottle of water, even the most affordable is, you're paying upwards of, $1 a gallon. And if I want to get that fine Fiji water, well, I might have to empty my IRA. But what comes from the tap here in New Orleans, and this is, I think, generally true in most, metropolitan areas, it's less than a penny a gallon. It's a fraction of a cent per gallon. So and again, it doesn't come in a plastic container that I have to then dispose of. Those are, where does that fit into the public health discussion? That issue of, really, diverting scarce resources, whether they're financial resources that a family has, or it's, taking the things that we use to make plastic that could be used for other things, and also how we deal with plastic waste, which becomes a very significant contributor to some aspects of water pollution.
But I think bottled water will be useful, especially during emergency situations. Like, for example, we live in New Orleans, and it is always good to at least store some bottled waters during the hurricane season in case we will need that. Or when we have a boil water advisory, bottled water is one of the options for drinking water purposes.
I know in my own, I'm a hiker and a camper, and I I can always carry a filter with me when I'm hiking. And I find that, quite frankly, I've used it in New Orleans, like after a hurricane or after a power outage, where is that a good idea? And, you know, I guess as a supplement to your water supply, and as opposed to maybe, you know, getting cases and cases of bottled water. And, you know, what would you recommend in that direction?
Yeah, I think filtration doesn't hurt, certainly, and cleaning up the water through activated carbon and things like that doesn't hurt. If you have the luxury of being able to do that, that's great. Not everybody has that option.
No, and again, quite frankly, until I started, you know, really, you know, getting smarter about not how I purify water on a trail, I realized that it actually works at home too. So, you know,
Or, you know, you can use unscented household chlorine bleach, you know, to disinfect the water during emergency, if you have that supply.
well, you know, we were talking earlier about, you know, how we manage water and water, you know, the benefits of water, the risks of water differently in different communities, like out west, where, you know, water is relatively scarce. There's a competition for water, and at some point it comes down to one user versus another. And this is, you know, if you read the news much or you talk to your relatives out west, you know that, you know, it's a question of whether, are we going to be able to grow crops in California, or are we going to provide, you know, water for cities, or are we going to have water for nature? A lot of my, you know, my friends who are more into market economics say, well, why don't we just let the market determine what we do? Can't we just, you know, set prices, and then, you know, the winners win and the losers don't? That's not just a Western issue, obviously, as we just discussed, but do you see that, you know, the notion of using price as a way of driving water stewardship and even addressing aspects of public health becoming more prominent, and anything we should be, you know, on guard for there?
I think water is essential. I don't think it is. I know it is. And I don't think price is a good way from a public health perspective of cutting the cards on this deal.
Well, it's a good point that the fact is that, you know, water is essential, you know, and, you know, it's like charging for air in some ways. And I mentioned earlier that, you know, my monthly water bill here in New Orleans, I imagine yours is similar, you know, it's higher than I'd like it to be. But most of what I'm paying for is the cost of bringing the water to me. That's why I'm paying less than a penny a gallon. And that's really the cost. I'm not actually paying for the water itself. I'm paying for the right to use it, and the service of cleaning it. And that's generally true. In its natural form, most water has no price because it can't be sold. It's a public, you know, it's a public amenity. And that makes it hard to conserve sometimes, because if it's essentially free, why would people conserve? And that's, I guess it's one of the reasons we need laws, because, you know, right, if there's not going to be a market that drives things, well, what does? And so I think that is going to be a growing issue. I think the question of who is entitled to water. We hear that water is a right, but does that mean you have a right to it where you want it, when you want it? You know, if I want it on the moon, do I have a right to it? And the answer is, it gets complicated. So yes, Let's see what else. Oh, we're starting to get some questions in the chat. Let me see. One of the better questions I see right now is that how do people who are administering our water, like public officials, and they've got a big job to do, how do they get to pal around with people like us and learn all the swell things we learn? And how do we learn about how hard it is to actually, provide a service, to people who may not always understand it and may not really feel comfortable or confident that they're getting a good return on their investment? How does our world fit with theirs, and how can it be better? Dr. Awe, I'm going to give you that one first.
Well, I think that's an important question and interesting. So I think we need to understand, as a consumers, we need to understand our the source of our water, and also the water quality, and and whether, and also know how it is being treated, and if it is safe to drink. Although public water is regulated, but it can sometimes get contaminated. So like a change in your water taste, color, or smell is not necessarily a health concern. However, sometimes a change can be a sign of problems. So, and if you notice a change in your water, call your water providers, the public water system company, and you can always ask them to test your drinking water if you are not if you're not if you're not if you find a change of the drinking water. So
the fact that again, people should always be on the lookout for, does it smell different? Does it look different? Because it means there may be something different in the water. Now, one of the questions that comes up, and you mentioned it earlier, Charles, that Flint, Michigan was a situation where a public water system changed its source water, and it turned out there was not all source water is the same, and it contributed, actually led to the lead crisis. So could that happen here? I mean, do we have, oh no, don't say that.
Sure, it's possible. So I kept an aquarium for a while, and turns out our water is very alkaline, and I didn't realize that. And, had a fish disaster from that, and it's just from the alkalinity of our water. And that alkalinity, it turns out, protects us from dissolving lead out of our pipes. And so if we change source water to a more acidic water, it would be similar to what would happen in Flint, assuming that you have some lead pipes in your system. The water board actually produces very good lead-free water, but it's what the traffic of the water to your house, somewhere between there and your home, is where the lead contamination is occurring. And that's what happened in Flint.
So the answer may be, and I know this is currently the direction that federal law is pushing us, maybe slower than many people would want, is can we remove those lead pipes? And if we do, what's the smart thing to replace it with? Plastic?
There's arguments for and against any kind of plumbing, plastic or copper or other materials. but they're better, all better than lead. So,
Well, you know, here in New Orleans, we used hollowed out logs for a while for aspects.
right.
So then again, I don't know that we want to cut down all of our trees, you know, to do that.
Well, I know that, you know, as part of the capital improvement program, the city, you know, is replacing the lead services between the water main and the meters. So, but it is important to keep in mind that even replacing the lead pipe, this may cause a temporary elevation in lead levels in your drinking water as well. So, you know, if you are, you know, notified that the lead service from the water main will be replaced, and I think, you know, you should at least, you know, you should flush your faucet with cold water, you know, one at a time, you know, continue to do that for at least a month before you use that for drinking and cooking.
So things we can do on the household side to, I guess, reduce, if not, not eliminate those risks. And as you mentioned, using cold water, you know, for cooking, and also letting your water run I guess, someplace between 30 seconds and 7 hours. Which would you suggest is the right number?
Yes, and yeah, I mean, you know, the responsibility for replacing lead pipe is shared between the city, you know, water provider and the property owner as well. So, you know, if the public service line between the meter and the street is made of lead, so the city is responsible for it. So, and the property owners are responsible for the water service line, you know, that runs from the water meter into the building, and also all faucet, taps, and plumbing inside the building that may contain lead. So,
well, that's an interesting point. And again, I noticed when I got my annual report from the Sewage and Water Board here in New Orleans, it made a point of reminding me that, you know, certain pipes were my business. And if I wanted to replace them, it was my business and my expense. But does it make, you know, how much sense does it make, you know, to leave, if you will, my part of the lead pipe system in place if the city is replacing its? Or on the other hand, if I go to the expense and trouble to replace my, you know, the pipes I'm responsible for, am I really, you know, am I going to see enough benefit to, you know, if the city hasn't replaced its pipes? And I know in some cities it's moving much slower than in others. So, you know, is there a balance there, or is this one of those places where public policy really needs to seek to coordinate? So the idea is let's get the lead out, not, you know, let's go at it piecemeal. Any thoughts on that?
So removing some of the pipes will probably make it better, but it won't eliminate the problem. And so I think we have to take the best public health approach would be a coordinated response, as you suggested, to work with homeowners and the Sewage and Water Board or whatever city or county you're in. A combined approach would be best.
Because I'm willing to bet, I remember when I first bought a house or tried to buy a house the first time, I knew how much the house was going to cost, and I knew how much my insurance was going to be, and I was on a pretty tight budget. I didn't know or know to ask, what are the pipes like? You know, and quite frankly, until, you know, my son was born, I wasn't thinking that much. But you realize that lead manifests differently and, has different risk factors for different age groups or people with, different immune systems. I wish I had known. I might not have bought, or looked at some of the houses I ended up looking at. But this seems to me to be one of the issues that, can really surprise homeowners, young parents and people on fixed incomes, or, does the public, I realize that you guys are not, in the business of solving every problem as much as we would like you to. But we also recognize that public health is a discipline. On the grading on the curve, does a pretty good job of marshaling, information, opportunity, and delivering benefits on a broad scale. Quite frankly, it's one of the few areas that, we were able to do that. I think we've just seen that with vaccines. We've seen it with SARS. We've seen it with, the AIDS crisis. We, quite frankly, addressing, systemic resource and health problems turns out to be one of the things we're decent at. Have you guys come up with an idea that the rest of us could get behind to, make all of this better? Or do you need a couple more days?
We probably need a little while.
Fair enough. Well, I'll give you those days, but I can tell you that as someone who works from the law side of the house, the lawyers need help. We often don't know what to ask for. And I think that's one of the reasons that interdisciplinary kind of conversations like we're doing right now are actually hugely important. So yes.
Well, yeah, I totally agree, but I think, it is important to understand the risk, in terms of the water usage, like, like for example, infants or young children, or even pregnant women and elderly, and people with weak immune system, they are often at increased risk, for becoming sick after drinking contaminated water. So understanding the risk, I think is a better strategies to avoid any potential health problems associated with waters.
I'm not hearing a one size fits all, silver bullet here, and I have to say I'm greatly disappointed. That's what I was told to expect, but I also think, again, since a lot of places get their water from groundwater and surface water, and sometimes it's the same water. I mean, I think it's one of the things people don't always understand, that wells can be connected to rivers and lakes in the same way that, and water can flow both ways. And contaminants that can be in the soil, as you mentioned earlier, certain naturally occurring things. I may have a river that's pretty clean, but if it feeds an aquifer, by the time it gets to that well, it may have some stuff in it it didn't have in the river, and it can work both ways. As we see, places, like the Southwest, which in all candor, for the most part in the history of, humans, civilization, we didn't really think to build large metropolitan areas in places with so little water. And if it hadn't been for the invention of certain legal regimes which made the water available, it wouldn't have happened then either. But that's where we are right now. But as some of those water resources play out and the competition for water goes up, if you were going to be, talking to a water manager in, let's say, Las Vegas, who's very familiar with the Colorado River, very familiar with, certain groundwater resources, But if they got one of their wishes, which would be a pipeline from the Mississippi, and I want to be very clear, this is not a hypothetical. I have over in my drawer here, the 1968 Texas Water Plan, which called for pumping roughly the annual equivalent of the entire Colorado River over to Texas. And again, why not? In their view, water that reaches the Gulf of Mexico is wasted. And that was, reflects two different viewpoints, not only just ethically, but legally. And, but if you were going to be, if someone asked you, what would be some of the issues initially from a public health standpoint, of bringing waters they've never seen, again, like with Flint, if we shift a water source, what would you like to have known? Do you have any words of wisdom or caution for our Western friends before we get too far into this sharing business?
I'll let Tiong answer that one. He's more in the microbial area. So I think that's probably the biggest, maybe the biggest.
I think in the West, we have to, the water reuse or wastewater reuse has been very, helpful in terms of supply, new resources of water. So, but we need to understand what are the potential long-term health effects in reusing wastewater, especially for drinking purposes. And there are many research and study, have been conducted and are currently being conducted to address these problems.
Well, I think there's going to be a huge, explosion of interest in understanding some of this, and B, technological and equitable solutions. I mean, it's curious if you look internationally how different places have tried to deal with this. Israel, quite frankly, has really been a pioneer in water conservation, and to the point where they actually now have surpluses at times, and heaven knows that their challenges are not too dissimilar than you may find in Arizona. But again, there have to be things that drive that innovation and the deployment of the innovation. And I know that Europe, and at least Western Europe and North America, stand out among other places in the world for the way we actually use potable water for everything. I mean, the same water I might wash my car with is the same water I would drink.
Yeah.
So, and if you go to major cities, most places, they don't do that. I mean, in fact, your tap water may be clean enough to cook with, especially if you boil it, but you wouldn't normally drink it without additional purification. Do you think that those lessons have any application here, or are we so committed to the notion of what comes out of the tap as something you should feel comfortable with?
Yes, I think we should look at wastewater as alternative water sources, and keep in mind that even in New Orleans, we draw drinking water from Mississippi River, which also receive numerous upstream wastewater discharge. So this is known as de facto reuse. So de facto reuse is a situation where reuse of treated wastewater is practiced, but it's not often officially recognized. However, the river water from Mississippi River is pumped, to the water treatment plant for purification. So, and in the West, especially in California, the wastewater has been purified using advanced technology to make it safe for human consumption.
That brings up another question, because obviously the one place that many communities have, whether it's next door to them or beneath their feet, is saltwater. I mean, there are places that are running out of fresh water, from whatever the source, but there's normally, still relatively abundant sources of water. Desalination, gets talked about a lot, but it seems to be A, expensive, and B, carry with it some of its own issues. Where do you see that fitting into the picture?
It seems like a very energy intensive process. The Saudis do very well with desalinization. Israel, California has some desalination plants, and those are working, but they just rejected building another one. The taxpayers didn't want another desalinization plant out in California. So it's a solution. I'm not sure it's the best solution.
John, what do you think?
Well, I agree with Dr. Miller. I think it's a good solution, but it's very energy intensive. I will support using desalination if we can find a new treatment technologies that that requires less energy to do so. Otherwise, it's going to create another set of environmental problems.
Well, that's a good one. Someone once tried to explain it to me. Obviously, I'm still learning. Was that if desalination is the answer, you should ask yourself, what was the question? Because it can make water available. Everybody knows this, but it takes a lot of energy, takes a lot of money, and it leaves lots of pretty problematic things behind. I mean, hypersaline, very concentrated minerals are a toxin essentially, and where you put it, how you manage it. In some ways, it's sort of the water equivalent of nuclear power. There are many good things that go with it, but you still have to deal with the backside. And I'm glad you mentioned the situation in California, and Florida's done the same. Where what I have seen, at least in the United States, desal really do is get people to think about its practicality. There's almost always, at least up front, some other way you can conserve or reuse water that is easier, less problematic, and more affordable. But until you have that alternative on the table, people don't, they don't have to make a choice. So I do think, clearly desalination is part of the equation, but it is not a silver bullet. In fact, I don't think that there are that I have seen. Before we run out of time, I wanted to see if there's anything that you guys wish we had asked you that we haven't, or that you've heard the others say, speak about, that you wanted to jump in on. So I'm going to let you turn the floor over to you for a minute.
Well, I'd just end by saying that water is a precious resource, and we need to conserve it when we can. We have some legislation that's coming up on this issue of how to keep our water cleaner. And we just had a recent Supreme Court decision on air pollution. And I think some decisions are coming up on water pollution as well.
That's a great point. And for those of you who really want to follow this from a legal side, I invite you to. In fact, my shop does a weekly newsletter called TU Waterways, where we try to keep track of some of this. But the game, is always shifting. What state and federal agencies are even allowed to do shifts with time. In the US Senate, there's a resolution being introduced today to, object to, the Biden administration's efforts to, clarify how the National Environmental Policy Act works. There are two primary schools of thought about that, which is that's where environmental impact statements come from. One is it's really, really important to make informed decisions, and we should really respect that. And the other is that it costs a lot, it takes a lot of time, and we should, it's overly bureaucratic, and we don't really need it. I would say here in New Orleans, the idea of whether we really need it was answered in Hurricane Katrina, because the levees that were built were designed before we had NEPA. And it wouldn't have been built that way. The Mississippi River Gulf Outlet wouldn't have been built maybe at all if they'd had to at least ask some of those questions. And also always, first of all, the questions are fair, but there's a difference between, a program that's not running well and a program that's not allowed to run well. I mean, I do know that, the number of people who, if I walk over to the Army Corps of Engineers, who they have to work on these issues, is less than it was 2 decades ago. Yet they're being asked to do more work. You can change the law all you want, but if you don't have the people and the resources to apply the law, don't blame the law, So I think it's going to be increasingly clear as we talk about water health, public health, what tools do we really have, and do we allow ourselves to use them? Good point. Dr. Ah, what did you hear that you wish you?
So I will end by saying, the US has one of the safest drinking water supply in the world. However, the water that we use can be safer, and the water contamination can still occur. For example, about 7 million Americans get sick every year from diseases spread through water. So know where your drinking water comes from and how it has been treated, and if it is safe to use or drink.
That sounds like very good advice. And with that, we're pretty much at the end of our discussion. I'd like to, again, thank both of you, Dr. Ah, Dr. Miller, for taking the time to at least educate me. I need it maybe more than most. And I'd like to thank our participants. I've been trying to track some of the questions and observations in the comments, and they're great. I wish I'd had the time just to go through them all, and that might have been a better way of doing this, but only so much time. And I'm definitely hoping that, Margot and the School of Public Health decide there's more to be done in this venue, in this arena. So thank you. It's been my pleasure. And I guess we'll turn it back over.